Okay, so 7 years ago I got a back surgery. I have a problem with herniated disc, and then I have a pain my, I don't know how to say this, but I have a pain here, and now I have pain uh, my back.
Alright guys, so as we see over here, what the patient was explaining before, the patient had a disc herniation and also had disc herniation surgery. So we see the scars over here from the laparoscopic incisions over here to operate on this fellow over here. And the patient was, ever since the surgery from 7 years ago, ever since then on, been having a lot of pain in both Achilles and both ankles. Okay, a lot of pain over there, and eventually, okay, and recently started developing a lot of pain in this region of here as well. Okay, so let's go ahead, let's take a look, see what's going on. Okay. So first we're going to do instrumentation. We're going to take a look, see if there is any potential heat differences on the spine. Now normal, I don't want to see any reading whatsoever. Abnormal, we start to see a pattern break. And there's a pattern break right at this level. So this is one of our objective indicators. We have another one right here as well. There are two spots, pretty close together. So this is one of our objective indicators, what we're looking for, that confirms the presence of the structural abnormality. Now, another tidbit is what the patient is also explaining about, since the patient originally had a lot of sharp low back pain from the disc herniation, had a surgery, and yet still continues to experience low back pain and also more problems such as the ankle pains from the Achilles and the pain over here, that term is called failed low back surgery syndrome or failed surgery back syndrome. Okay? Now, because this one's more chronic, we do have to alter the angulation of the instrumentation, because since it's been there for quite some time, the nerve, there's quite a bit of nerve interference at this particular level. Other things what we also see, okay, is on this side over here, we also start to see differences in muscles. Okay, and this over here is kind of loose. Here's kind of tight. This side over here is a little tight. This here side here is also tight as well. It's all is a protective mechanism to try to protect this region over here. Another thing we're also visualizing and seeing is that there's quite a bit of swelling in this region over here. I want to see it nice and smooth, however, quite a bit of fluid accumulating here and also here, and yet it's puffed all the way around this region over here. Okay? And to the point, once again, it starts to accumulate down here as well. Quite a bit of fluid. But this one here is the most. So I'm going to check what's going on up here as well. See, there's quite a bit of fluid right there, right between the spinous processes over here and here as well. Not too bad here. Looks some fluid, but not too bad. Okay. Relax. Next thing we'll do is also going to check your neck as well. Head down. Okay. Neck is clear. No instrumentation reading in the neck. Right now we're checking for any abnormal movement in the neck. There is none. We're also going to check for any abnormal movement in the pelvic foundation. Okay. Right now, the hips move right to the left. We're also checking for the sacrum, moving just fine. And the left hip also moving just fine as well. So now, we'll check for this fifth lumbar right over here, and we push forward. Tender right there. And also, there's not much movement in there as well, because it's very chronic, very problematic. So let's also see what else is going on. Every structure above. Okay, everything seems to be moving. Yeah, right there. Tender right there, huh? A lot of pain?
Yeah.
Yeah, not too bad there. A little pain there too, huh?
Yeah.
Okay, not too bad. We're going to mark that. Keep an eye on it. Okay. Let's double check that fifth lumbar. See which way it moved. So you could easily turn to the left. You can't turn to the right too well. It's stuck. Okay. You have problems also tilting towards the right. Not too bad to the left. Okay, so that gives an idea of where the problem is. In this X-ray structural analysis, this is the fifth lumbar disc that got operated on 7 years ago, and the patient still continues to experience some low back pains and also pain in his ankles and in Achilles. So the result is this. This structure over here, what happened is that it went a little bit backwards, but more importantly, it tilted inferiorwards as well. So this is the one we need to correct on him. And in the mid-back over here, what we see is, if you take a look at the lines over here, this structure over here is slightly backwards, and in addition to this disc on the back is slightly swollen over here, more in the back. This is the one we need to correct on as well. Okay, come on up.
Okay.
What do you feel?
No more pain. A little bit, but not too much like before.
Okay. How's the ankles now?
Good.
Come again?
Good.
Good?
Yeah.
You don't feel pain down there anymore?
No.
How do you like that? We didn't even touch or do anything to your ankles yet. Right? Move your neck around.
Thank you so much.
Tell me, how's it feel right now?
Much better now.
Move your head to
Yeah.
the left and right.
Yeah. And back. And before when I sit, I can start feel the pain. So now I'm sitting and I feel good.
Okay. Nice.
Thank you very much.
You're welcome. First things first, we're going to check both ankles, see if there's any structural abnormalities with them. Okay. This one's slightly stuck, so we'll set this one. Okay, medial talus. So how do you feel the ankles right now?
Very, very good. I feel good. No more pain, and I can walk around very good. So before when I can stand up. I had bad pain, so now I feel much better. Thank you, doctor.
Oh, you're welcome. All right.